Good morning, everyone. Once again, welcome to my YouTube channel at Dr. Mwiti Dengaina, where we get to learn medicine at the comfort of our sitting rooms. Today, I am doing another new topic and a condition that is very, very common among our women, among our sisters, among our mothers, and among everybody else. Today, I'll be doing something that we refer to as dysmenorrhea in medical terms. I will explain what it means. I'll define what dysmenorrhea is. I will talk how does this disease occur. I will talk about the types of dysmenorrhea, and I will talk the characteristics for you to know whether you have type 1 or whether you have the type 2. I will talk about the causes of dysmenorrhea, and I will talk on how you can diagnose whether you have this condition. Without further ado, I will just go straight to the topic and let you know that what we mean by dysmenorrhea. And dysmenorrhea in simple terms is painful menstrual period. Anytime when a woman is menstruating and you experience a lot of pain, that is what we refer to as dysmenorrhea in medical terms. Now, how does this dysmenorrhea occur? Now, in other words, in every menstruation, the uterus of a woman must contract. And this contraction is facilitated by a chemical that we refer to as prostaglandins. Now, this prostaglandin chemical helps in contracting and in expanding of the uterus. Now, if it happens the uterus contracts too much, that is what at some point causes pain. Now, how does this pain occur? When the prostaglandin chemicals are released, they lead into contraction of the uterus. Now, if the uterus contracts too strongly, it might constrict or it might press down the blood vessels that are nearby the uterus. When these blood vessels have been pressed down, they cut the oxygen supply into the uterus, hence causing pain. So that is how pain occurs during menstruation. If this uterus contracts too much, it leans into the constriction. It presses the blood vessels that are available around the uterus. When now these blood vessels have been constricted, the oxygen supply is cut off. When the oxygen supply is cut off, that is when it results into pain. Now, when the uterus contracts too much, then it means that there is a high number of prostaglandin chemicals that is being released. So whichever time that you experience pain, that is what happens, and that chemical is which is responsible into causing all this pain. Now, in this painful period, we have the two types of dysmenorrhea. And I say dysmenorrhea is the painful periods. Now, we have these two types. Number one, we have the primary dysmenorrhea and we have the secondary dysmenorrhea. The features of these two, the primary dysmenorrhea, this is whereby the pain is on and off, or in other words, the pain is recurrent. It comes and it goes. In this dysmenorrhea thing, when it is primary, it can as well be associated with vomiting. It can be associated with fatigue or tiredness. It can be associated with nausea. It can be associated with diarrhea. Now, that is primary dysmenorrhea. Primary dysmenorrhea, in most cases, in this period you might experience pain, and the other period there is no pain. Now, this is what we refer to as the primary dysmenorrhea. And when you're having this pain, you must have vomiting, you must have tiredness, you must have diarrhea, you must have the feeling of nauseated, and sometimes you might have even issues with the dizziness. That is the primary dysmenorrhea. This primary dysmenorrhea, it can go away as you continue to age or even after giving birth. After you give birth, this primary dysmenorrhea, in most cases, it disappears. And after that, you start experiencing your menses normally. Then we have secondary dysmenorrhea. Secondary dysmenorrhea, we term it as secondary dysmenorrhea because it is caused by an underlying condition in the female reproductive system. This is when you have either an infection, you have a tumor or a growth in the uterus. That is what we refer to as the secondary dysmenorrhea. Secondary dysmenorrhea must be caused by a certain disease, or it must be caused by a certain infection that is affecting the reproductive system. I will talk about like 5 conditions that can lead to secondary dysmenorrhea. And the very first condition that we start with a condition that we refer to it as endometriosis. Endometriosis, this is a condition whereby the endometrial lining of the uterus grows outside the uterus. Even before I proceed, the uterus being its, let me term it as a house where the baby grows. The uterus itself, it contains of 3 muscles. We have the inner muscle that is inside, that is where the baby now lies. We refer to as the endometrium. We have the mitral layer that we refer to as the myometrium, and we have the outer layer that is into contact with other organs that we refer to as the serosa. Now, if this endometrial lining the muscle or the layer that is inside the uterus, forgetting about the mitral one and forget about the outer one. Now, if this now endometrial lining here, the layer inside the uterus, this is where the baby grows and this is where implantation occurs. Now, if now this layer grows outside the uterus, that is what we refer to as the endometriosis, and that one can cause painful period. Number 2 condition, it's whereby we have something that we refer to a disease or a condition that we refer to as adenomyosis. Adenomyosis, this is where the uterus lining grows into a muscle. Right now, this lining might even grow into the mitral, at the mitral. The uterus lining either in the inside, when it grows inside the myometrium, because the myometrium it's a layer and it's also a muscle. Now, if it grows inside there, that is what we refer to as adenomyosis. And if this adenomyosis occurs, what happens is that the uterus grows more, it becomes more heavier, and during menses it can be painful and it can as well lead to bleeding. Another condition is something that we refer to as the pelvic inflammatory disease, or what we refer to as the PID. If you have a PID, and a PID is infection, it can be as a result of recurrent UTI, or it can be as a result of an STI, the species of chlamydia and the gonorrhea. So if it happens you have this PID, it can as well resort to painful period. We have something else that we refer to as the cervical stenosis. Cervical stenosis, this is the narrowing of the cervix. The cervical, that is the cervix, and stenosis is the narrowing of it's a narrowing. So if the cervix is so much narrowed, it can as well lead to this painful period. And lastly, we have something that we refer to as the uterine fibrin. If you know the uterine fibrin, that is a growth that grows inside the uterus. And remember, we said that painful periods occurs as a result of, if the blood vessels nearby the uterus, they will be restricted and the blood of the oxygen supply fails, it results into pain. So if you have this growth, if you have these fibroids, when the uterus continues to contract, it might cause these fibroids and these growths to also press down the blood supply, hence and also the oxygen supply, resulting into pain. Now, how do we diagnose whether you have dysmenorrhea and what kind of dysmenorrhea do you have? Number one, we diagnose it through a good history taking. If you come into the hospital with a history of you experience painful periods, we ask the issues of whether you are vomiting, whether you have diarrhea, whether you have nausea, whether you have tiredness, then we will be able to know that this is primary dysmenorrhea. Because in secondary dysmenorrhea, you does not have diarrhea, you does not have vomiting, you does not have tiredness, you does not have anything. The only thing that you have is pain and pain and pain alone. That is what you have in secondary dysmenorrhea. Now, the second way that we diagnose, we can also diagnose through inspection. In inspection, there is something that we refer to as the speculum. We request a woman to lie and rest, and then we insert the speculum into the vagina. Throughout the vagina, we can be able to see whether the cervix is narrowed. We can be able to see whether there is any other structural abnormality into the cervix or into the vagina that again may result into painful periods. And something else that we can do, we can also do something that we refer to as palpation. Palpation. Palpation is whereby we palpate your abdomen to feel if we will feel any mass. So if it happens we feel any hand mass, then we'll be able to realize and we'll be able to confirm that you are having a uterine fibroid. And one another very basic thing that we do to test whether you have dysmenorrhea is something that we refer to as an ultrasound, and what majority of you knows as scan. So when you do an abdominal scan, we can check. This abdominal scan will help us to know whether you have fibroids, whether you have an adenomyosis, or whether you have PID, or also it tells us whether you have endometriosis. But good thing is, whichever kind of dysmenorrhea that you have, whichever kind of pain that you experience, may it be primary dysmenorrhea or may it be secondary dysmenorrhea, all of these problems are treatable. So if at all times you have any kind of pain, you go into the hospital, you need to go into the hospital, because all these problems, all of them, they can be treated. So depending on the type that you have, it can be treated, and treatment differs. So that is all about dysmenorrhea. In the next part, the treatment, you can give painkillers, and if it's about the second dysmenorrhea, then we treat the underlying cause. If you have PID, we treat. If you have adenomyosis, we treat. If you have endometriosis, we treat that. If you have cervical stenosis or you have fibroids, we treat. So the treatment for secondary dysmenorrhea depends on the cause. The cause that you have, or the disease or the condition that you have leading to dysmenorrhea. That's what we treat in secondary dysmenorrhea. But in primary dysmenorrhea, we can help you to give you some hormonal therapy, and we can also give medication that we refer to as the NSAIDs, things like the brufen, things like meloxicam, things like mefenamic acid, and so on and so forth. So in primary dysmenorrhea, we just give medications to tackle. And another thing is that in primary dysmenorrhea, this pain occurs 2 to 3 days before your actual menses. But in secondary dysmenorrhea, it starts earlier on your menses, and it can also last longer. But the main thing is that all these conditions, may it be primary or may it be secondary, it can be treated. In case of any other question, kindly ask into the comment section. If you like this video, you can also like. If you love it, just comment, like, share, and please don't forget to subscribe into my YouTube channel. Until the next video, then I sign out and bye-bye.